Hi everybody, my name is Dr. Hilary Booth and I'm a naturopathic doctor and welcome to my video blog. I want to talk about the gut-brain relationship this week, which is a really interesting area of new research. But before I get going on that, I just want to remind you to make sure that you're using up all of your extended healthcare insurance dollars before the end of the year. If you do have extended healthcare coverage, this is the perfect time to book your first appointment with me so that we can start tackling your health goals before the end of the new year. And that way you go into the new year as your best and most healthy self. So you can book an appointment by going to our website or by calling the office, and I'd be happy to go through any of your health goals with you. So as I mentioned today in our video blog, we're going to be talking about the gut-brain relationship. So many of us are painfully aware of what it's like to have a gut-wrenching experience or to have butterflies in your stomach. So it's no surprise that there's a relationship between the brain and the gut. And most of us think of this as a relationship that our emotions play a huge role on our gut, and they absolutely do. But today I really want to talk about the fact that the gut plays more of a role on our mental, emotional health than we may have realized. So research is still emerging about this relationship, but for decades we've been looking at things sort of as a top-down, brain controls everything kind of situation. But what's really emerging now is that the gut has a huge role to play on the brain. And so about in the past 10 years or so, we've started to realize that this communication is a two-way street. And this should come as no surprise if we think about it from an evolutionary perspective. Now, if you think about the most simple life form that there is, it's basically just a mouth and a digestive tract. And even a lot of the animals in the animal kingdom that are closely related to us, their brains are a fraction of the size of ours. So you have to start to think that at some point in our evolutionary history, it was our gut that was calling the shots, and it was what was keeping us alive on a day-to-day basis by controlling, basically, eating as our primary function. Now, it makes some sense then that as we evolved into these creatures with complex emotions and the ability to reason and think and feel and have abstract thoughts, all these things that make us human, that the gut evolved with it. And the two of them are so interconnected that it's important to look at things from both perspectives. So the gut and the brain are in constant communication, and they use hormones to do this. They also use the nervous system to do this. They use the bugs that are living in our digestive tracts, and they also use the immune system in order to communicate back and forth and control what's going on in our bodies. So now I'm going to explore why it's important to look at the gut when exploring mental emotional health and when exploring digestive disorders and when exploring disorders of stress. So serotonin is our gut-to-brain messenger. It's the primary messenger, and it's called a neurotransmitter. Now, basically, about 95% of the serotonin in our bodies is produced and stored in the gut, in these cells called enterochromaffin cells. Now, when serotonin is released from these cells in the gut, it swims up through our bloodstream to the brain where there are receptors for serotonin. The brain then sort of notices or hears the serotonin by when they are captured in those receptors, and the brain is able to then interact with the outside world. The effects that it has is that serotonin regulates mood and appetite and sleep. It also regulates memory, and it regulates learning. So when we are deficient in serotonin, or when that pathway where the gut's releasing the serotonin to kind of swim up to the brain isn't working properly, we start getting a lot of problems in the body. We get mood dysregulation like depression and anxiety. We get appetite dysregulation, so oftentimes these people are underweight, or you struggle with weight gain. Or you struggle with weight loss, so you experience easy weight gain. You may experience migraines. You may experience poor sleep quality, or memory problems, or difficulty learning new things. Now, this is a huge array of different tasks that you don't usually think about as being gut-type tasks. These are things that we think about as being brain-type things, but really, when you break it down from a biochemical perspective, it's the gut that is causing all these things to be regulated. Now, whenever patients present with any of these symptoms, you really do need to look at the gut and try and figure out what's going on there that's causing this serotonin pathway to be disrupted. Now, so what can cause that disruption? And the major thing that we see is inflammation. Now, inflammation in the gut has been shown to impair those enterochromaffin cells that we were talking about earlier. Those are our serotonin producing and holding cells in the gut. Now, when those cells are inflamed, they aren't able to produce and hold the serotonin in order to be released as efficiently as they normally should. And as a result, those messages going up to the brain can't be sent. So the gut becomes inflamed when we eat foods that we're allergic to or that we have food intolerances to. It also becomes inflamed when we eat processed foods and when we eat lots of sugars. Now, this inflammation process basically is a whole cascade of responses that are caused by our immune system being overstimulated. And this can also be caused by an overgrowth of bad bacteria in the gut, and it can also be caused by antibiotic use and by yeast overgrowth. Now, all these things contribute to the inflammation that affects the serotonin pathway. So when we think about treatment, we need to kind of go back to the basics and find the cause, and we need to get rid of this inflammation. The way we do this is by changing the diet, by giving you anti-inflammatory herbs and supplements, and by giving you a good probiotic to replenish that gut flora. And there are tons of other things that we can do other than this to help to mitigate the amount of serotonin that's being produced in the body, to help you kind of bridge that gap and bring serotonin up to a more optimal level. So we can do things like 5-HTP, which you may have heard of before, which is a supplement that is the precursor to serotonin in the body. So it gives the body the building blocks it needs to produce serotonin. But we can take it one step further, and we can go even back before 5-HTP. There's something called tryptophan. Tryptophan is just a protein. So what we need to do is make sure that you're getting adequate amounts of protein in your diet. This means at least 40 grams per day, if not more, depending on your body weight and size. And you can watch my video about protein to learn more about that. But tryptophan is the specific protein that we need to make serotonin, and it's found in lots of different foods. It's found in eggs and in spirulina. It's found in fish like salmon and cod. It's found in cheese and soy and meats. And it's also found in sesame seeds and in sunflower seeds. So you can eat any of these foods in order to give yourself a boost of that tryptophan and help to produce more serotonin. Now, we mentioned about gut bacteria a second ago, so I'll go back to that for a second. So emerging studies are showing that if they take animals and they put them in situations where they're either given probiotics, or they're given pathogenic infections, or they're given antibiotics, or they're given a germ-free environment, it basically is showing that the gut flora has a major role to play in regulating mood and anxiety and in pain and cognition. And a recent other study shows that the relationship between the gut microbes and the brain is independent of the serotonin that we were just talking about, that pathway, and it's independent of inflammation in the system and independent of the nervous system. So the gut flora have a whole other role to play on top of this about that gut to brain interaction that we've been talking about. So somehow these little bugs living in our guts are able to alter the signals being sent from the gut to the brain in order to alter the way that we interact with our world. Now, they don't actually have a 100% understanding of how these microbes do that, but what we do understand is that we do need to make sure that we are in an environment where we're getting the good bacteria and not an overgrowth of bad bacteria in our guts in order to have this signal pathway functioning properly. So this means that part of any treatment protocol for mood and anxiety, but also for memory and for migraines, for pain, and for cognition, all needs to have some component of helping to fix that gut flora in the system in order to make sure that that pathway is functioning properly. So what's the bottom line of all this? The bottom line is that we are barely scratching the surface here. It's the tip of the iceberg of this research that's coming out about the gut to brain interactions and communications. But what we do know is that any type of brain function that we're thinking about treating or working with, you really need to go back to looking at the gut and making sure that you're treating that at the same time as you're treating the brain. So it's really important to make sure that we're looking out for more research that's coming out and learning more and more about how we can affect the gut in order to manipulate and improve the pathway of control from the gut up to the brain in order to interact with our world the best way that we possibly can. So if you have any questions about this, I'd be happy to chat more about it with you. You can feel free to contact me through our website at drshaunaderoux.com or by calling the office, and I'd be happy to book an appointment with you to discuss this or any of your other health concerns, especially before the end of the year when our health benefits turn over. Thank you so much for watching, everybody, and I hope you have a really great week.